do.
Okay, so here's the thing. So I'm going to point out what we're going to do on Kimberly is we're going to use the hyaluronic acid filler, Juvederm Ultra, with lidocaine mixed with it in this area to help soften this line, sort of help soften this line, and a little at the corners of the mouth and the marionette lines. So that's what we're going to do. Does that go with you? Mm-hmm. Do you want to take a look in the mirror? Okay. So Kim, I'm going to probably, at least if you've never had this before, do cannula technique on you. Okay. Have you heard of that?
I have.
You have? Okay.
Just a little bit.
Yeah. So basically, it makes less bruising. So, I mean, it's really what I've been doing more and more frequently. I've been doing it for, I don't know, like 8 years. But more recently, I've been using it as much as I can so that people don't bruise as much.
I like that.
Yeah. There's a little area I'll still have to use a regular needle, right? You know, it basically for really fine work, you still have to use your regular needle. But for the cannula, it's really good to, so I don't have to poke it as much in here.
All right.
Okay?
Wonderful.
Okay. So we'll get the numbing on. This is a mixture of multiple different numbings, benzocaine, lidocaine, tetracaine, much better than, you know, most numbing creams because it's made by a compounding pharmacy. And do you have allergies to anything? Yeah, we've done numbing on you before. All right. This will last about a year. Although, I think if we've done filler in here before, what we've done before will start to wear off a year from when we injected that. So, for instance, this will be in here for a year, but if something we put in 6 months ago wears off in 6 months, you might feel the need to have more in 6 months. So a lot of times we'll recommend if somebody needs more than one syringe to sort of stagger it. Okay. You know, so we come several times a year and maintain so you look the same all the time, as opposed to get a whole lot and wait a year and look not so great and then great again. We'd rather just keep it slow and steady. Okay. So Kimberly, how long have you been getting sort of filler, Botox?
Last 2-3 years.
Yeah, so not that long.
Not very long.
You just started not that long ago. Okay, and here it is, our product. I'm gonna let you numb for a little bit. Yeah. So, do you want a magazine or anything?
I'm comfortable.
All right, sounds good. To do some filler in the fine line right here where her chin sort of meets her lower lip. And we were just discussing that area we can fill in. What filler does is stretches the line from underneath. So it's less effective for very, very fine lines and more effective for where there is volume loss. So what we can do is correct the volume loss, which will make the line look better, but there may still be a little bit of etching or fine line that's in that very shallow area. And then we would use a thinner filler, Volbella or Bellatero, to etch out fine lines. All right, we'll get you numb. Other things that can be helpful with fine lines include microneedling and peels and skincare such as Retin-A. All right, so now we are going to use a special technique on Kim that helps prevent bruising. It's called a cannula. With the cannula, we do use a needle to make a little hole in the skin, but then instead of injecting with a needle, we're injecting with a blunt needle. So it looks like a needle, but it's not sharp. so that if it butts up against a blood vessel, it does not puncture the blood vessel. So it makes for less bruising and also less pain during the procedure. So this is a syringe of Juvederm. Comes pre-packaged like this. And then this is the cannula, which again, instead of being sharp, is blunt. The filler still can come out of it. Can you see that? Little tiny drop of filler right there. And then, but because it's blunt, it cannot puncture the skin, so we do have to use a needle for that. So we're gonna go right in. You're gonna feel a poke. Doing okay?
Doing great.
Good. And then right where that little dot is, we go in with the cannula. It just makes for a safer injection as well. How did that feel for you? Not too bad, right?
Not at all.
Now we'll do a little bit more in here. Kind of the same process where we poke with the needle and then go back in with the cannula. Still doing okay? I know. That's the thing about the cannula. Yeah. And by the way, it's no small task to get the needle into that tiny little hole that like effortlessly. That's just years and years of using cannula.
You're a
yeah.
good inserter.
All right. So now, I mean, this looks so good. Take a look, even at the top right there. Right?
Yes. Very nice.
Yeah, so now we're gonna kind of start working on this other area. And I do think we're gonna end up using 2 syringes today. Open your mouth a little. There you go. Maybe close. Open again. And just like we discussed, maybe close your mouth. I'll probably end up using just a regular needle, maybe just to get that little corner right there.
Okay.
So first thing I'll do, can I have you tilt your chin down? Sometimes we'll see a little volume loss right there, and then we'll kind of get this. Actually, you don't have much volume loss there. We'll kind of go right into here for you. These are the areas that look really natural. Nobody ever is going to say, oh, she had work done or looks different, but you will, we just lose volume sometimes in this area, this area, this area, even the corner of our lip right there. And replacing that volume just makes us look the way we did look maybe 5-10 years ago. Very natural. It's not changing the structure of your face or your general appearance. Okay. All right, so I'm going to ask you to open just a little bit. Good. Gonna get right in here. And I am gonna do just this bit right there. And maybe close your mouth. So now one thing that's really fun, once we take the numbing off the other side, is looking at one side to the other. I think you could use just a touch right in there. We'll hold this for a minute. Do you mind holding that?
No, not at all.
Okay, good. And then I'll kind of start taking your numbing off on this side. All right, let's take this off. All right, let me have you open your mouth. I like to massage a little. Okay, and close. And then, okay, I have a touch left. This is the hardest part, no smiling.
Okay.
I know. You ask people not to smile, and then they want to smile. All right, it's like a game my children play. I'll just wait it out. Because mostly what I'm trying to do is just assess kind of where, if anywhere, you have a little bit left here would give you the most benefit. Okay, and I'm gonna say right in here. Okay, good. And this is the first syringe. Open your mouth again and close. All right, take a look.
Oh, definitely refreshing.
Mm-hmm.
Very nice.
Good.
What a difference.
Now we'll do the other side. All right, now we're gonna do the right side. Poke. I'm going to ask you to turn away from me just a little more, maybe towards the door. Okay, good. Perfect. So for people who bruise easily, you don't bruise very easily, do you, Kim?
No, not horribly.
No. Have you had bruising in the past?
Just minor.
Little? Yeah. So, but for people who do bruise easily, definitely I would recommend that they just stick with this technique. And there are also certain areas that bruise very easily, like the upper lip, where this can make a big difference. And then we're even going to have you turn just slightly more away. Yep. Have you turn back towards me. Let me have you tilt your chin down. Okay. All right, we're not going to be able to do that one with the cannula. We're going to do this that we did right here, same, that we did on the other side, and then I'm going to come back with the needle and sort of do the finishing touches. The other thing people don't think about is as we lose volume, our profile becomes, we lose volume in here and here. We basically lose this volume, and when you put it back, it does make a more youthful profile. All right, so I have a touch left. We'll massage everything, and then we'll just kind of decide if there's any one spot that we think that you would like. Or if not, we could touch your lips. Although I would have done them you first. Okay. All right, let's take a look in the mirror. good.
So much better.
Mm-hmm.
What a difference.
I feel like still maybe a little right in there, and right there. Sound good?
You want me to look towards you?
Straightforward is good.
Okay.
Yeah. When I'm working sort of right on the side here, it's actually good for me, you know, it helps me get to the side better. Yep. Okay. All right, let me have you open your mouth. We're gonna massage everything. Looks good. Okay. And that is it. 2 syringes of the Juvederm. Maybe have you hold just a little. We will do a little pressure. Right here. Yep. Okay, good. In a minute we can do take a look at how it looks after.
Okay.
Yeah.
I didn't feel anything.
Was that
nice.
good?
Very nice with the cannula.
Mm-hmm.
Very nice.
Sometimes it's a little odd feeling because you can tell there's something in there, but it's not as sharp. It's not as uncomfortable.
Oh no,
It's
not at
still
all.
there, but
No, very,
right.
very subdued. If
Mm-hmm.
anything.
Mm-hmm.
Oh, that was nice.
Good. Yeah. Yeah. And if, like I say, if you're not someone who bruises typically, you know, that piece of it may not seem all that much different to you. But my patients who do bruise easily, this is
Oh, it's fine.
life-changing. I mean, right, they don't have to worry about whether they can go to work the next day or, yeah, all of that. Mm-hmm.
No, that was
Yeah.
walk in the park.
Maybe you're a little red. So the other thing, did you bring your makeup?
I did.
We might even want to take a picture of you after your makeup's on.
I can do that.
All right. So I'll just keep holding this for a sec. All right, there we go.